Hi everybody and welcome to video number 9, your appointment with the oncologist. This period of time for me was very, very stressful. The reasons that it was stressful was that I knew I was going to have chemotherapy. I had no idea what that meant. I didn't know when it was going to start or how it was going to work. I didn't know how it was going to affect work. I had no idea at this point when the appointment was for the oncologist, so I was carrying on working as normal. And so during those 4 weeks to 6 weeks, I started to get a jumpy nerve in my eye, which got worse and worse and worse over that period of time. And so I've realised that my diary is very, very precious to me. I don't think I realised how much it created stress. Before I went in, I tried to get as much information as I could. I kept in touch with the breast cancer nurses. I read the Complete Guide to Breast Cancer's Chemotherapy chapter, so I had a bit of an idea. That was quite tough to read because it really does do a great job of explaining what the side effects are. I did a bit of research online. I followed a few things on social media and I found an amazing resource called the Ticking Off Breast Cancer. It's a website. It's run by a lady that also has had breast cancer, and she's written a book, which is equally a good thing to get too. And on that website and in that book are questions that you can take to your oncologist to ask them about these next steps. So a valuable resource. So I had a good look at all these things and I wrote down some questions, went along to the oncologist appointment, and during that appointment it was an examination of the breast that had been operated on, just to make sure that recovery was going well. Then they go on to talk about your sort of pathology results, really. And what we used in that appointment was a piece of software on the computer called Predict. And this is something that you can access on the website as well. Okay, so this is the website, breast.predict.nhs.uk /tool. And it goes straight to a homepage where you press start your test. And basically, you're just using the information that you have been given by the surgeon. So we'll just run through it now. So as you can see, I am of no particular type, my cancer. So I'm not DCIS or LCIS. So I can tap in no at that point. I am 50, or not 2050. Postmenopausal, unfortunately, I am no. ER status is positive. HER2 is negative. I am negative in terms of the protein test Ki67. The size of the tumour was 22 millimetres. It's a grade 1, detected by symptoms, and there was 1 positive node. And no. So you then run down here and you then get to this, and it's basically saying, do you want hormone therapy? Yes. Chemotherapy, 3rd generation chemo is basically, I'll talk about that in a moment. And you then start to get some results. So surgery only, I would have an 89% of surviving in 10 years. If I added hormone therapy onto that, that's tamoxifen, that would give me an increase of 2.1%, so that's 91% overall survival. And if I have chemotherapy on top of that, that gets it to 93%. If death from breast cancer were excluded, 96% would survive at least 10 years and 4% would die of other causes. So you can see that for me, it is pretty, I'm pretty low risk. And that did ask the question, I suppose, of whether to do chemotherapy or just to stick to radiotherapy and hormone therapy. And we asked that question. We said, you know, is there any need? Do we just, you know, skip it? But it was very clear once the oncologist spoke a little bit more about it that, you know, if this comes back, just my crooked glasses, if this comes back, then it would be classed as secondary cancer. And when you've got secondary breast cancer, your options of you know, treatment are limited. So I decided that it meant, you know, let's just do everything. And I talked earlier about that generation, third generation chemo and second generation chemo. A little bit confusing. Third generation chemo is what we call FEC, which is 3 drugs beginning with, one beginning with an F, one beginning with an E, and one beginning with a C. And second generation chemo is a Taxol, which is a plant-based chemo. At this stage, we talked about what would be next and what would be my treatment. And he decided, because I was young, because it was low risk, we were going to give it, you know, everything. So we gave it, if you like, the golden bullet. Doing FEC for 3 rounds, that would be every 3 weeks. You'd go into hospital and you'd have those 3 drugs. And so in 9 weeks in total, and then after that you would have paclitaxel, which would be given in a low dosage over 12 weeks every week. I was given that information. I was also told I would get a month off, so once chemo finished, a month off, then I would start radiotherapy, which would be about 4 to 6 weeks, and then at the same time I would start my hormone therapy. So I walked away with that information, making that decision really in the room that I wanted to go for that. But I also asked him when if I could start on a particular date, and I started to look at, you know, how would having those 3 rounds of FEC before Christmas affect key dates. You know, on reflection now, things changed, which affected the dates, but it made me feel better that I had some control on when I was going to start. And I was told at that point that I would have an appointment with the nurse. At the nurse's appointment, a tour of the ward, so I went round and I had a look. I could see that I would be going to sit in a nice comfortable chair, drip of some form that would be bringing the drugs into my system. I would probably be in there for about 5 hours, particularly with FEC, which is the first one I was going through. I spoke to a couple of ladies that were there that were going through treatment and were wearing a cold cap to ask them how they were finding that. We talked about cold capping and we discussed the benefits and the disadvantages, and I will talk more about that in a later video, but I was given a booklet about that. We also talked about infection, because infection is a huge risk during chemotherapy. So I had lots and lots of leaflets such as this about how to deal with infection. I also had, you know, just some domestic stuff about the unit, parking. I had information about food hygiene because of the risk of infection, another leaflet on that. Also about staying hydrated and taking your temperature. And then there was also a little piece about how we would be administering the drugs. So you can either have them in a vein in your hand, or you could have a PICC line, which again, I'm going to talk to you about. So lots and lots of information, and it's really good here. I went on my own to the nurse's appointment, but again, if you think you're a little bit overwhelmed with what's going on, it's always a good idea to bring somebody with you that can make notes for you. And I would say that with all the appointments. Long video really of, you know, many different things that are happening, but hopefully you found that useful.